Today I will discuss so many topics have been discussed, and in the initial class I have already told you community medicine is very large. Different topics, different subjects, different types of disciplines are there. So if you go through the Park's book or other things, you will see so many subjects, and so many subjects are a bit different, I should say. So for this reason you have to know all disciplines. So one of the important aspect of medical science is called occupational health. I don't know whether do you know or not. Occupational health is the, in NMC, Medical Council of India, it is there is a course, and that course was, I should say was, because I was the head of the department of that was taught in All India Institute of Hygiene and Public Health, Calcutta. I don't know whether do you know what All India Institute of Hygiene and Public Health. It is near to Central Government Institute. It is near to Tropical Medicine at the crossing of Kolutola Street and Central Avenue. And since British times, you can say, since British times, there one course was being taught. It is a MCA recognized course called DIH, Diploma in Industrial Health. Actually, previously the name was called Industrial Health. Afterwards, it was thought that any people working in any occupation, suppose our occupation, when you will be doctors, your occupation, I may not be the doctor, I may be the teacher. The teaching occupation is hazardous. There are occupational hazards are there, and it is the branch developed a lot, but there are different factories act in Government of India, and other types of act is there. Suppose you have heard that organized occupations, suppose steel plant, steel industry, railway industry, or big mines industry. Any other industry, if any medical officer is being recruited, he must be diploma in industrial health, and it is MCA recognized. But for the last few years, this diploma has been stopped. In our country, there is no MD in occupational health. In so many forums, it was discussed. I also advocated, but it is not yet started. Okay, so but occupational health hazards is coming a lot. Importance, and it has been expanding. But for you, maybe for exam point of view, you have to know a bit detail about occupational health hazards, ergonomics, occupational health hazards, etc. Now, before that, you have to know that occupation as an environment. Often, some of the people has used to say that 1/4 of our life we are in working occupation. Suppose in 24 hours in one day, people are working in 8 hours or 10 hours. In IT sector, they may be working more also. So, if you see the whole lifespan of us, a big part of it we are in occupations, working. That working may be in some industry, factory, in agricultural field, in markets, in offices, or in different institutes, so many. Even it is said that the women working in the kitchen and at the home, that is also in some occupation. So for this reason, nowadays any housewife not suppose filling up some forms, their occupation is written. He used to write homemaker. Homemaker is a common name. They don't write housewives or like that, because in home also that is an internal environment, and he or she is working throughout the day and night. For this reason, she is exposed to different types of hazards. Not only kitchen hazards or internal room hazards, so many are there. So, before going to the occupational environment, we should know what is environment. Anybody? In the environment is external factors are living or non-living, material or non-material, which surrounds us. So, these are the external factors which may be living or non-living, or material or non-material, which are surrounding us. And usually closely there are 4 types of factors in the environment. One is physical environment. As you know, physical always I used to say this: illumination, light, noise, air, housing, radiation, these are all physical factors, and they are always affecting us. And that affection is much more if people in the particular occupation, if in any occupation, this suppose air pollution is more, or where working water pollution is there much more, we are also exposed, general people are also exposed, but there may be more. Or someone working in the some plants, steel plants or nothing, different types of noise is there, and radiation is there. As you know, radiation hazards is also in our medical science who are working radiotherapy, radiology, etc. etc. Chemical environment, there may be pollution, gases, exhaust, pesticides, etc. That may be from air, but that physical environment air is there, but there some pollution may be there that come in the chemical environment, because pollutants, gases, exhaust, they have some chemical composition. Biological environment, plant and animal kingdom, bacteria, virus, insects, rodents, rats and rodents, etc. And social, that is nowadays this is also important, social environment, the culture, habits, political environment, occupation, income, literacy, religion, politics, everything has a bearing on human health, of which, so this is in general environment. If a short note comes environment, if you remember in the point wise, you elaborate it, no problem. I always used to say, always remember in point wise, don't, and you write in point wise, you will get the marks. Don't like that you write 3 pages, 4 pages, 6 pages, you may not get that much of marks. We will discuss much more in occupational environment. Occupational environment is, if anybody has what is our occupational environment, so occupational environment is the sum of external or internal conditions and influences prevailing at the place of work, which has a bearing on the health of the working population. So it is the external or internal conditions. Internal means in you are working, you are mixing with your colleagues, your emotional makeup with other colleagues. So internal conditions and some targets, some fulfillments, these may be the internal environment. And external factors means again same thing, physical environment, chemical environment, other, all these things are external environments. So which has a bearing on the working population. So this is called occupational environment, people where are working. And again I am telling you, by occupation means don't think that it is only industrial like that. Occupation is everyone working in any field is supposed to occupational health hazards. If a driver driving a bus, or a driver driving a car, or a teacher working in a teaching hospital, or we doctors, nurses, health workers working in the hospitals, that is also exposed to occupational environment, different types of. And it is said that now occupational environment is much worse in hospitals. As you know, so many factors are there. Hospital borne infection. Hospital borne infection ke ki bole? Tomra porikha dite jabe. Hospital borne infection, there is a scientific name, nosocomial infection. So people exposed to nosocomial infections, etc. Basically 3 types of interactions occur in occupational environment. Again same, just like general environment. Man, 3 types of by which he is exposed. Man exposed with the physical, chemical and biological agents. So a worker working in an environment, he is exposed to interaction with the physical environment, chemical environment and biological environment. Biological always there are organisms, etc., etc., everything is there. And other types of occupational environment may be man with the machines, equipment or devices. This is nowadays called ergonomics. There is a specialized branch developed. Suppose I am sitting with this chair. So it is often said as in our house or home that when you sit chair, you should not sit like that or like that. You should not sit. You sit properly with your back on the back of the chair, and you must open. You are working with the computer. So there must be ideal relationship with your with your working with machine, that's like machine, and with other devices, equipments, etc. Because most of the people, I am suffering from now today I have taken some painkiller from low back pain. Most of the musculoskeletal disorders are due to ergonomic problem. We are working. As you see, this is common sense. I don't know whether you are thinking. Nowadays, very much common in urban areas, we use for defecation commode. It is ideal or up. Previous squatting position was good. Squatting position was not good because you have to sit in like that. Commode you can sit properly. So now it is said that, and for when people are using commode, it has been seen several types of other problems are less. Previously, we have seen plenty of cases when you are students, rectal prolapse, vaginal prolapse and all those things. So many things are there. And other types of stress and strain towards back, muscle strain, etc., etc. These are reduced. Okay. So even people are working, our mothers, our grandmothers were used to working, sitting and all these things. Jeta bole, unun, all like that. But now ideally the slabs are there, you have to work like that. So you should not unnecessary bend. When you want to bend, properly bend. So these are all ergonomic, the principle of ergonomics. So people working in the machines, if it is not properly fitted, suppose someone driving a car, you see all these things ergonomic design. Nowadays these cars are coming. Our steering is a bit when I feel comfortable. Steering is not like that, you cannot properly hurt. Or steering is not like that, you cannot properly like that. So it must be according to the. So the Indian cars which are manufactured, that is, it is Indian population has some standard heights, etc. So according to that standard height, the design is made like that, the steering is like that. So these are all ergonomic designs. So occupational environment may be man with machines, equipments, etc. And occupational environment may be man with man or colleagues. So three types of occupational environment is there. Man with the physical, chemical, biological agents. Man means here worker, everybody. Man with machines, equipment and devices, and man with man and colleagues, where emotional problems and all those things are there. আমার যদি কলিগের সাথে ভালো রিলেশন না থাকে, always I will remain tense and strained. There will be stress and strain. You will suffer from different types of diseases. Or if you have don't good relation with your bosses or subordinate staffs, you will suffer from different types of diseases. Okay, so these types of three types of physical environment, occupational environment may take place. Coming to the occupational health hazards, these are the occupational environment, three types. Now in this occupational environment, all those things, what are the different hazards? Hazards means agents. Suppose noise is the agent, bacteria is the agent, virus is the agent. We have discussed agent host environment. So in occupational environment also, agent may be multifactorial. Not maybe, usually it is multifactorial. So there may be physical hazards, physical occupational hazards. Examples of physical occupational hazards are maybe heat, cold, illumination, noise, ultraviolet or other times radiation hazards. People working in that type of others are there. Illumination, proper light or not is there. Okay, so these are occupational hazards. You know, suppose it is said that people driving or railway drivers, they have to do some color blindness test. So actually they have to see that proper traffic signals. So in our country there may not be follows that like that. So many times accidents are there because they are not properly color blindness. A bit of color blindness is always with you. I have some color blindness with red and violet and all those things. Okay, so this is like that, very small. I may not be that much of problem. There may be chemical hazards. There is liquids, gases, dusts, etc. That may be chemical hazards. There may be biological hazards. Bacteria, virus, parasites, fungus, etc. There may be biological hazards. Mechanical hazards means machinery hazards. Machines, all these are hazards. Ergonomic hazards, I have already discussed. Ergonomics not properly fitted and all those things. Not properly fitted with the machines or like that. So there may be accidents, there may be other problems, there may be musculoskeletal problems, all those things are there. Psychosocial hazards, man with the man with the colleagues, I have already discussed. The lack of job satisfaction, frustration, insecurity, or poor human relationships, stress and strain, not happy with your salary, etc. These are always problems. So these are psychosocial hazards. So all these things interact between man and different physical combustion agents, man with the man and man with the machines, etc., devices, etc. And these types of, all types of hazards are there. Physical hazards, chemical hazards, mechanical. It is not difficult. I always used to say community medicine is not difficult. Only you have to think of it. A bit of study, you have to think of it, and accordingly you will answer. But problem is, most of the people don't give that much of importance to community medicine. But you are now appearing, so I am telling you, in your postgraduate course admission test, maximum number of questions will come from community medicine. Maximum. So ergonomics, sometimes there is service, sometimes a short notes comes or may be asked what is ergonomics. Ergonomics is the actually ideal fitting the job to the worker, ideally fitting the job to the worker accordingly, according to your height, according to your physical conditions, or your machine should be short, your office space, your seating arrangement, all those things must be proper. Suppose you are writing, you see, when we write in exams, if it is not properly fitted, you may feel stress and strain, betha, all those things, because it is not properly fitted. So if it is properly fitted, it will not work. So ergonomics object is to achieve the best mutual adjustment of man and worker with his or her work, for the improvement of human efficiency. If ergonomically not properly designed, your efficiency will be less. You cannot give properly. As suppose when you appear for exams, if not ergonomically proper sitting arrangement was there, you cannot finish your paper. It may take time. You will finish, all those problems are there. Well-being, that is, less injuries will be there, less accidents will be there, ill health will be there, and in quality of the product. So the objectives of ergonomics science is to achieve the best mutual adjustment of man and worker, or worker with his or her work, for the improvement of human efficiency. You can work more, work efficiency or human efficiency, your well-being, workers' well-being, which causes less injuries, less accidents, good, and the quality of the product. The product you will make up, it will be qualitative product, because you can give your best efficiency or all this occupational efficiency. Okay. So the subject is called occupational health. That means the subject which deals with the occupational environment, the subject which deals with the physical, chemical, biological agents, hazards, or man and ergonomic hazards, or psychosocial hazards, and to prevent them from the suffering. It is scientifically everything is there. Worker working, but problem is in our country, I don't know how many you will know, people working in the mines, they are suffering from coal workers pneumoconiosis, they suffer from silicosis, and most of them die early. And people working in the different construction site, because they are not using masks, etc., so they are inhaling different types of dust, different types of, that has a physical hazards and chemical hazards also, they suffer different types of disease. So occupational is that type of subject which prevent and control the people, so that human efficiency and health will be maintained, they will not suffer, or they will less suffer from occupational diseases. Occupational diseases, big chapter, so many diseases are there. So occupational health should aim at the promotion and maintenance. I already told you that don't forget the definition of WHO definition of health throughout your life. In exams also, one cannot answer properly, he or she will be asked definition of health. If he cannot answer definition of health and mistake is there, but he will not pass. So like that, if you know the definition of health, you can make the definition of occupational health. Same thing. It is a state of complete physical, mental and social well-being, and not merely the absence of disease or any infirmity. So it is like that. It is a promotion and maintenance of highest degree of physical, mental and social well-being of workers in all occupations. You have to maintain the promotion and maintenance of highest degree of health in all occupations, the physical, mental well-being through actions like that. How much action? By prevention among workers of departures from health caused by their working conditions, so that workers should not suffer. The prevention among workers from departures from the health of their working conditions. Protection of workers in their employment from risk resulting from factors affecting the health. In the initial classes, you remember the community medicine, levels of prevention, promotive disorders, all these apply in all answers, and you will answer also like that. It is my suggestion to you, any question comes, theory, try to answer in levels of prevention. Any question can be answered in primary level, secondary level, tertiary level, if you think in that way, if you know the subject. So, yeah, disease wise, communicable disease wise is very easy, as you know, primary prevention you know. Even communicable disease also, it is also know what is primary prevention, all those things. So, if you write not like that, in books may not be like that, but if you write, yes, some prevention control written at the primary prevention, secondary prevention, but any answer can be given, most of the answers can be given by primary prevention, secondary prevention, tertiary prevention, accordingly point wise. So, accordingly like that, and there these terms always come, health promotion. So, promotion, protection, health protection, etc. Specific protection. As you know, answer is immunization, etc., etc., all those things. Placing and maintenance of workers in all occupational environment adapted to the physiological and psychological conditions. Physiological means anatomical and physiological. A person to person differs. What is his physiological components? What is the mental faculty also? So, accordingly, he or should be put in that particular job. So, his problems will be less. In our country, not always maintained, but in some of the organized sector, steel industry, very good occupational health services, and it is maintained. Or shipyard industries. I have visited so many industries, things that occupational health and department is there. They are maintaining it. Adaptation of work to man and each man to his job by ergonomic design. Adaptation. So, occupational health is maintained by these 4 types: prevention among workers, they do not suffer; protection from the workers from resulting from different adverse effects, those adverse effects from health, and placing and maintenance of workers in all occupational environments adapted to physiological and psychological conditions, and adaptation of work of man and each man to his job, properly adjustment, then he remain happy, work efficiency will be more, and he'll suffer less also. And this is the ultimate goal, adaptation of work to man and each of the men. So, ultimate goal of the occupational health is adaptation of work to man and each man to his jobs. Okay. So, prevention control of occupational health hazards, how will you do anything? Always, especially still, most of the people are working in industrial areas, industries, big industries, factories, plants, mines, shipyard industry, agricultural industry, so many vital. What do you know, if anybody asks you, what is the largest industry in our country? Common sense? আমাদের লার্জেস্ট ইন্ডাস্ট্রি কি? সেটা কিন্তু ইন্ডাস্ট্রি, কিন্তু লোকে বলে ওটা ইন্ডাস্ট্রি নয়, এগ্রিকালচার ইন্ডাস্ট্রি। এগ্রিকালচার ইন্ডাস্ট্রি লার্জেস্ট ইন্ডাস্ট্রি in our country, and people are exposed to, these farmers exposed to agricultural different occupational health hazards, but we are not giving that much of importance because they are not organized, they are নিজস্ব, no organized sector is there who are monitoring it. Okay, so it is mainly all those things, mainly for industries or people are working, the so-called industry, factories, engineering measures, proper good housekeeping, it is a proper good housekeeping, good ventilation. So, you have to maintain environmental sanitation. Housekeeping is not proper, even amader barito, if things are blown like that, you cannot move in your flat or room properly. So, you must keep it good housekeeping and good ventilation. So for this reason you will see, we will see our offices, our working conditions, and when we see English cinema or Western cinema, we see their conditions. So they are maintaining good housekeeping. When we go to a particular best hotels or like that, you see good housekeeping is very, very good. All those things, and good ventilation is maintained. Substitution. Substitution means anything not properly working, or hazard is there, or it is not properly, you substitute that part. As we substitute in our machines, we substitute some chips in our computer. Like that, some engineering design, something you are substituting it. Or substitution, another example is there. Previously, benzene was used in petrol, so that crude person. Now benzene is not used. So we are using it. Now, sorry, lead got used to previously in petrol. Now lead has different types of hazards. So we are using other things. So you are substituting it so that it can causes less hazard. Total enclosure. Someone, more exhaust is coming, more noise is coming, or more fumes are coming. So you are enclosing that particular plants. If you visit a plant, you will understand that one. We will increasing it, or by glasses and all those things. One is monitoring, or all these things. So you are enclosing it, or you are monitoring from outside. Or if someone is working, maybe one or two worker is working, so less effect will be there. Total exhaust ventilation. Plenty of dust occurs, chemical hazards are there, so exhaust ventilation is more. We use exhaust fans in our houses also, in our restrooms, in our bathrooms we use it. So this is for exhaust ventilation should be much more. Dust control measures. How do you maintain dust control measures? Dust control measures আমাদের বাড়িতেও করতে পারি, রাস্তাঘাটেও করে অনেকে, দেখবে কি করে, জল ছেটানো, water sprinkling, number one. It is common thing. But dust control measures are so many in industries. There are nowadays tremendous scientific discovery. They suck the dust, exhaust, all these things, or where dust is there, you sprinkle water. So many control measures are there, and you will dust control measures is there. So you can maintain that one. Segregation. You segregate something, some types of work, all those things. Segregation is very one more. Segregation is almost a bit like of total enclosure, but it may not be total enclosure, but a bit of segregate it, though it causes less harms, less problem, less factors coming out, less agents coming out. These are engineering methods. Environmental assessments of work. Another method is day to day you are measuring air pollution, you are measuring dust, amount of dust, you are measuring noise. There are beautiful noise level meters are there. As you know, in Calcutta during puja time or festival time, West Bengal Pollution Control Board, or during Holi, not Holi, sorry, during Kali Puja etc., Diwali, they go out and measure the decibels, I mean noise, and accordingly as per law they can take action. All those things, and then so it is also maybe should be done in the working environment. Environmental assessment of the workplace hazards, physical, chemical, biological, etc. All. Second method, it is the engineering methods. This is very important. It is called often, the short name is called PPE, personal protective equipments. Are you using PPE? তোমরা use করছো PPE, use করো না? While driving, don't you use helmet? That is PPE. While driving or going out, don't you use goggles? That is PPE. If you walk suppose in the muddy conditions, especially traffic police etc., they use gumboots. These are PPE. All these are PPEs. A surgeon doing operations using gloves, that is PPE. We are using aprons, that is also PPE, personal protective devices. So all these are there, and very important masks are there nowadays, which controls all types of dust and chemicals. Costly, a bit costly machines. যেটা কেউ দেখেছো অমিতাভ বচ্চনের পিঙ্কে অমিতাভ ওই যে বেরোচ্ছে একটা মাস্ক দিতে, দিস আর দ্য মাস্ক ভেরি কস্টলি। নাউডেজ হু আর ভেরি রিচ দে আর ইউজিং দোজ মাস্ক ইন দ্য, স্পেশালি এখন ইউজ হচ্ছে ইন দিল্লি। দিল্লি ইজ ভেরি মাচ পলিউটেড। I don't know whether you know, at present time Delhi is the worst polluted metro city in the world at present. So দিল্লির দিকে বেশি শীতকালের দিকে যাবে না, মানে সব people are remaining indoors. It is the most polluted city now in the world recently. So all these personal protective equipments should be provided to the workers. Gloves, machines, helmets, goggles and all those things. লেদ মেশিনে যারা কাজ করে দেখবে স্পার্ক হয়, দিস স্পার্কস ফ্রম, ডোন্ট লুক অ্যাট দেম, দিস কজেস visual problems, so they wear particular goggles or like that. So there has to be all those things are there. So all these are personal protective equipment. So these are the one is engineering methods, then use of personal protective measures, then some medical measures are also there which will be done by our doctors, nurses, etc. etc. So medical measures is, it is ideal, তোমাদের এখনো হয় না, আমাদের হয়েছিল when we were admitted in MBBS course, আমাদের preliminary chest x-ray এখন হয় না, তারপরে urine examinations and other external examinations done by our usually আমাদের physiology department হতো, তারা টেস্ট করতেন আর কি, লাইক দ্যাট, ভিশন টেস্ট করতে, এখন হয় না। তো প্রি প্লেসমেন্ট মেডিকেল এক্সামিনেশন মিন্স বিফোর এন্টারিং টু দ্য জব that particular worker should be examined pre-placement, before entering the job. Or appointment letter পেয়েছে, appointment letter পাওয়ার পরে they must be examined properly. The basic parameters, basic data, BP, etc., plus, etc., basic parameters, basic biochemical parameters, and other things also should be maintained, pre-placement mentioned. Whether someone suffering from COPD, chronic obstructive pulmonary disease, so I should not put him in that particular job where air pollution is much more, he will suffer more. If someone is suffering already some musculoskeletal disease or suppose any type of inferior extremity problem, so and his job is always standing, I should not put him. যে আমাদের এই যে ট্রাফিক পুলিশরা কাজ করে, they have to stand there for 7 to 8 hours throughout, so he cannot all those things. Someone suffering from varicose vein, so if you put them in that particular job where they are already standing, so they must, so pre-placement medical examination is very important, and this is done in organized sector. I have already told you, maybe railway industry or steel industry, mines industry, shipyard industry, big industries, or in chemical industries, all these things are maintained, pre-placement. They made the data and card then. And after entering the job, you do the periodical medical examinations. As we often say, এই বছর 3, যেমন আমাদের বলা হয় 3 বছর 4 বছর পরে লিপিড প্রোফাইল করবে, আমরা বয়স হচ্ছে, all those things. So like that, a frequency 3 or 4 years, 5 years, periodical pre-placement data is there, then you have to do periodical medical examinations. So that any deviation is there, you take proper care, management and problems, etc. Periodical medical examination. Who are in service, already in service, entering service, you have to maintain your records, very important. It is in our country we don't maintain records. In most of the এখন একটু হয়, especially in government medical colleges, if proper data is maintained, from that data you can do the research study. অনেকেই করে, suppose who are doing MD in obstetrics and gynecology, who are doing MD in radiotherapy and all those things. So if patients are coming, tremendous number of patients are coming to the medical colleges, government medical colleges. If their data, everything is maintained properly, I mean register is maintained, their socioeconomic characteristics, occupation, etc., residence, suffering, etc., maintained, you can, that register you can make it, for the last 5 years register you can make, and very good research study can be done. So good record keeping is very important. We don't maintain it. It is required for our personal point of view also, if we maintain the records. We of course nowadays maintain the records regarding our income, salary, প্রত্যেকে record maintain করে, so মনে রাখার জন্য Excel sheet on all those things. Health education, giving health education, workers education, etc. Reminders, how your health may be affected, in which occupation you are working, so these things, etc. If you are working from mines, they should know what is coal workers pneumoconiosis, silicosis, its problems, its complications, and advice. When use, always use it. And when you using, always use with machinery, always use gumboots or etc. All these things. Ladies working, not healthy long hair. So if hair is there, that must be properly maintained. আমরা অনেক পেশেন্ট দেখেছি যারা এই লম্বা হেয়ার মেশিনের মধ্যে আটকে গেছে, আটকে গিয়ে অ্যাক্সিডেন্ট হয়েছে। মেডিকেল ম্যানেজমেন্ট অফ অকুপেশনাল ডিজিজ এন্ড ইমার্জেন্সিস ইনক্লুডিং রেফারেল সার্ভিস। এই যে মেডিকেল ম্যানেজমেন্ট অফ অকুপেশনাল ডিজিজ, এটা হুইচ লেভেল অফ প্রিভেনশন? মেডিকেল ম্যানেজমেন্ট অফ অকুপেশনাল হুইচ লেভেল অফ প্রিভেনশন? আমি বললাম না, তোমরা ইনিশিয়াল ক্লাস করলে সব অ্যান্সার দেওয়া ইজি। টার্সিয়ারি, সেকেন্ডারি and tertiary. Tertiary you right last day. কিন্তু মেডিকেল ম্যানেজমেন্ট আমি বলেছি, ম্যানেজমেন্ট ইজ অলওয়েজ কামস ফার্স্ট। অলওয়েজ রিমেম্বার আওয়ার আর্লি ডায়াগনোসিস এন্ড ট্রিটমেন্ট ইজ দ্য মোটো। হ্যাঁ, রিহ্যাবিলিটেশন তো টার্সিয়ারি ইনক্লুডিং, এটা পরে আমি মেডিকেল ম্যানেজমেন্ট অফ অকুপেশনাল ডিজিজ বলেছি। মেডিকেল ম্যানেজমেন্ট ফার্স্ট ইউ শুড সে secondary level of prevention, be early diagnosis and treatment. Then you, of course, already develop. Then you come to the tertiary, disability limitations and rehabilitation, etc. etc. It is both. But এটা আমি এক্সাম্পল দেওয়ার জন্য বলছি। সুতরাং if you think in that way, suppose a question come on pneumoconiosis. So how pneumoconiosis can be prevented? So if you write primary level of prevention, secondary level of prevention, right? So medical emergency. In actually not for community medicine point of view, actually human health can be maintained if we maintain early diagnosis and treatment. For this reason it is called, which is the first number one treatable cancer in this world. Which one is the number one treatable cancer in this world? Common sense, number one treatable cancer, breast cancer. Breast cancer. So if you diagnose it early, plenty of women are there who are living properly. If you do proper radical mastectomy and very early কেউ করছে, যেমন অ্যাঞ্জেলিনা জোলি করে দিয়েছে, because her parents are suffering a particular gene which carries it. So ও আগেই mastectomy করে নিয়েছে, আর now cosmetic surgery is there, breast can be developed, etc. So, and what is the number one preventable cancer? That is also related to women. নাম্বার ওয়ান প্রিভেন্টেবল ক্যান্সার, এগুলো তো টিপস অফ দ্য মধ্যে থাকা উচিত। একটা ক্যান্সারের নাম করো যেটা কজড বাই ভাইরাস। ভেরি গুড, সার্ভাইকাল ক্যান্সার। সার্ভাইকাল ক্যান্সার, সার্ভাইকাল ক্যান্সার ইজ নাম্বার ওয়ান প্রিভেন্টেবল ক্যান্সার because it is caused by human papilloma virus, and we maintain the proper hygiene, if we maintain faithful sex. So as it is transmitted through sex, so if we maintain properly everything, so you can prevent cervical cancer. And also frequent pap stain, etc. pap smear if you do after 35 years or 40 years, suppose every 5 years or so, you can early diagnose it, so it can be prevented. So remember, number one treatable cancer, breast cancer. For this its prognosis is very good nowadays, and number one preventable cancer is cervical cancer. ওই জন্য cervical cancer much less in western countries. কি আমাদের এরিয়াতে, in especially in rural areas, they don't maintain proper hygiene, especially menstrual hygiene, etc. etc. For this reason, if you use proper sanitary napkins and etc. etc. keeping clean, etc. by health education you can maintain it. Legislative measures, by legal action, by some laws, preventive legislation by Indian Factories Act, very important. Indian Factories Act is there, it is always modified and all those things implement, so amendment comes and there all these things are there. But it is some of the organized sector it is following, in other sectors it cannot be followed, not yet followed. But it can do a lot. As I have already told you, in Environment Act is there, that how much should be the pollutants, it is there. How much should be the noise level, especially during festivals, etc. It is there. So if we maintain it, you can maintain it. and you can keep proper action. Social security measures like ESI Act. So if you maintain all those things, so prevention and control from occupational diseases or occupational hazards. Occupational hazards and occupational disease means, hazards means agents. This illumination may be hazards. This air in that is hazards. People are whispering and causing hazards. Hazards to you and to me also. They are whispering. That is hazards. You cannot properly listen, properly communicate, etc., etc. And diseases, occupational diseases or occupational means when these hazards causing illness. Okay, so all this, and the subject or discipline is called occupational health. So occupational health contains everything. What is the occupational hazards and all those things? Okay, so particular disease we will not discuss. That is accordingly all those things. There are some, it is some term environmental sanitation. Sometimes a question comes or short note comes environmental sanitation. So I have kept it. Environmental sanitation, sanitation kake bole, environmental sanitation kake bole. If you know all these things. So we discussed a bit about in general occupational health hazards. Some questions may come, not deep. I mean, major questions may not come from occupational health, but a fundamental will come and they may be asked. And you have to know a bit about sanitation, health hazards, etc., and all those things. This is the last month of your classes, is it not? So best of luck for your exams. It will be held in January. Okay, accordingly you go through. Most of you did not attend classes. Now my suggestion to you, go through the books properly, all subjects. Someone asking, he came to me, sir, what is the suggestions? I cannot say you suggestions. I don't give suggestions because I am not the examiner. How can I give suggestions? And questions may come. এখন তো কোশ্চেনের ধরন পাল্টে গেছে. Question will come throughout the whole subject of community medicine, plus minus. But much more important is, I am telling you, maternal and child health related, reproductive health, all those things much important. Demography much important. Community medicine general concepts, this is very important. Epidemiology, very important. Epidemiology means always a bit of statistics is there, that will come. All those things are very important. And sometimes health education and all those things comes about all those things. But if someone knows much of maternal and child health, by maternal and child health I used to say infant health, child health, adolescent health, whole reproductive health. You know the 90% of community medicine. কারণ আমরা জন্ম হচ্ছে, জন্মের পর মৃত্যু হচ্ছে, এই পুরোটাই তো maternal and child health. Maternal কথাটা খুব শর্টে বলা হয়, but maternal means women health, everything. Maternal does not mean only mother. Maternal and child health means whole.